Hello. Today I will be talking to you about current pap smear guidelines. So what is a pap smear? A pap smear is a collection of cells taken from the cervix for microscopic examination to detect cervical cancer. In fact, pap smears can be used to detect precancerous cell changes on the cervix long before cervical cancer develops. Most cervical cancer is caused by high-risk types of the human papillomavirus or HPV, particularly types 16 and 18. Can you believe that a virus can actually cause cervical cancer? In fact, the HPV virus can also cause cancer of the vagina, the vulva, the anus, and the penis, and it's also associated with causing genital warts. HPV is a very common sexually transmitted infection. Approximately 80% of women will be HPV positive at some time in their lives. However, the majority of HPV infections in women will clear within 1 to 2 years. Persistent cervical infection with high-risk types of the human papillomavirus can develop into precancerous lesions, which, if left untreated, can progress to cancer. So now let's talk about cervical dysplasia. Cervical dysplasia, or abnormal cell changes detected from pap test screening, can be classified according to the degree of abnormality or severity. Atypical squamous cells of undetermined significance, low-grade squamous intraepithelial lesions, and high-grade squamous intraepithelial lesions are all types of cervical dysplasia. So what happens if a pap test is abnormal? There are diagnostic tests that can be done for abnormal pap smears, such as a repeat pap or co-test, HPV testing, or colposcopy, which is a cervical biopsy. The American Society for Colposcopy and Cervical Pathology, or the ASCCP, recommends that cervical cancer screening with a pap test should start at age 21 for women. It is recommended for women ages 21 to 29 to get screening with cytology alone, that is just a pap smear, every 3 years. HPV testing should not be implemented to screen women ages 21 to 29, either as a standalone screening test or as a co-test with cytology. For women ages 30 to 65, it is recommended to get cytology testing alone every 3 years, or cytology and HPV co-testing every 5 years. Women who have had a hysterectomy with removal of the cervix for benign reasons do not need to get routine pap smears. So the ASCCP established guidelines for the management of abnormal pap smears, and we're going to talk about some of those guidelines. Women ages 21 to 24 with atypical squamous cells of undetermined significance who are also HPV positive should have a repeat cytology done in 12 months. For women ages 30 and over with negative cytology but who are HPV positive, it is recommended to repeat cycle testing in 1 year. For women ages 30 and over with atypical squamous cells of undetermined significance who are HPV negative, it is recommended to get a repeat HPV and pap test in 3 years. And for women who are ages 30 and over with atypical squamous cells of undetermined significance or low-grade squamous intraepithelial lesions who are also HPV positive, it is recommended for them to get an immediate colposcopy. So your physician should discuss your abnormal pap test with you and explain the next step in the management of your care, whether it be a repeat pap test or co-test, HPV testing, colposcopy, or another procedure. Cervical cancer is a highly preventable disease, and when this cancer is detected early from routine pap smear testing, it can be effectively treated and save women's lives. So please get routine pap smears, ladies, according to current guidelines. Thank you for viewing this public service announcement about pap smear guidelines to raise your awareness about a very important topic in women's health. Thank you.